John's back has not been feeling great. So we're going to take a look and see what we find out and use some neurokinetic therapy and see if we can help him out. So the first thing I'm going to do is look at his stability, and this is called perturbation, to see if he's able to hold himself upright. Touching really gently to see if his body's able to react to a little bit of pressure. So breathe in, and here, meet my pressure. So he's going to go over, right? Go here, breathe in, exhale. Good. Meet my pressure. Not so bad that way. Breathe in, and exhale. Meet my pressure this way, and breathe in, and exhale. Meet my pressure this way. Okay, so for him, moving backwards, he's a little unstable there. So relax your jaw. I'm going to see if I can just pick your feet up like this in a moment. I'll go very gentle pressure, and you'll see if you can keep your feet here. Gentle inhale. And when you're ready, you'll exhale. And right here, meet my pressure. And I'm able to pick his legs up. So that's given me some indication about his multifidus. So I know, because he's my husband, that he gets some back pain in this area around his sacrum, which there's a spring or a big piece of fascia there that should act just as a spring, but sometimes it does the work of some back muscles. So I'm going to get him to touch it. So this is your thoracic lumbar fascia, and he's giving it a little indication proprioception-wise to be ready, awake, and alert. And we'll test his back muscles again. Exhale. And right here, meet my pressure. I cannot move his legs. Good, keep breathing and exhale. So that would mean that that fascia right there is, when it's activated, is doing the work of his long multifidus. Right? So now we'll give him a little bit of a treatment so that he can take something home and fix those back muscles. I'm going to take a yoga tune-up ball on that little bit of that lower back. We love these, thank you, Jill. And just on the wall, I'm going to have him go actually in a circle for about 2 minutes, because around 2 minutes gives the brain, the motor control, an opportunity to take its dominance over that part of his body. So he's just rolled out about 2 minutes on his back. So let's see now if his back muscles are able to, what we call a neural hold in NKT. So again, this is my action. Take a breath in. Inhale. And exhale. Right here, meet my pressure here. Yes, good. So I'm just going to have him keep pressing down. I'm using a lot of muscle here. I cannot hold his legs up. I'm going to keep having him breathe to activate those smaller back muscles. Make it easy for him to hold that stability. I'm going to go back to the perturbation and see if he's able to stay upright on this angle. Exhale. I mean my pressure. Yes. And look, bicep. I'm pushing. Keep breathing. Really good. Great. So his homework is going to be to roll out that part of his low back, the thoracic lumbar fascia, and then he'll just come lay down right after, because you have to do these exercises one on top of each other, because you have to take off the motor control of the thing that's dominant and then bring back up right away. You've got a little opportunity then to strengthen the multifidi, and he's just going to do what the test is. Press his heels into the earth a few times. So you just press your heel down, right, over and over again, and he'll do this 10, 15, 20 times until he feels something called neural fatigue. Something else starts to try and work instead of those back muscles. So if he does this twice a day, 10 days so, a week, 7 to 10 days, he should have his multifidi back on his motor control, and back pain should be gone.